All right, so vertigo and dizziness comes up a lot, and it is rough on people. To understand it from a Chinese perspective, once again, one has to apply the system of 8 principles. First, taking into account, is this something from the outside coming in, such as a wind, a cold, a damp, a heat? Now, in this case, there's another something that could come in, and that's a bat, a hit, a trauma. Anyone that gets hit upside the head gets dizzy. Sometimes it stays. So that's another external cause in this particular case, leading to internal blood and qi stagnation. So the external causes in this particular one is somebody's in too much wind. It makes dizziness worse. And it can actually cause wind if it's too cold and damp and it constricts around the area, tweaking out the vestibular apparatus. We think the body is actually porous, and if somebody's in too much wind and cold, it can actually blow in through the body. That the skin membrane isn't a fixed wall. It's a permeable barrier that external environmental influences could go to the inside. And that would cause, cold sensation or heat sensation, depending if it's hot or cold. Aversion to wind, stiff neck. Those are the first causes of dizziness. Now, if that progresses and it goes in deeper, the external can go internal. And that's when the person gets the fever, the alternating chills and sweats, bitter taste in the mouth, irritability, what we call a lesser yang or a shao yang disease. That's actually an external case still. That's the deepest of the external, which sounds really correlated to the second condition that you were describing.
Perfect. Yeah.
Now, as far as the internal causes, these are there's one more external cause that I didn't describe, and that is just qi and blood stagnation in the channels. So there are people that their muscles are so tight and so rigid that it's pulling on the ear and the neck and it's pinching on the nerves, and then they get dizziness. I was treating one of these recently as well. It was a beautiful case. I guess, I'll skip describing that case for now. I'll continue just going through syndrome differentiation, just for the sake of consolidation. So the external causes are wind, cold, heat, damp from the outside, either in an external or on an internal, blocking the meridians, or there could be external blunt trauma. The internal cases, these are very prevalent, and the first one's the most prevalent, is liver fire, flaring upwards. Somebody's just so pissed off and so worked up and so red-headed that their temples are bulging and their eyes are bulging and their tongue's quivering and their eyes are out of their mouth. They're going to get dizzy. Even you can see me showing you that'll probably make you dizzy. So that's a true internal excess of liver fire. That could be caused by whiskey and chili peppers, or it could be caused by getting pissed off. It could be diet lifestyle, or it could be internal organ disharmony. It could also come from a deficient root. If a person doesn't have enough coolness, then they'll have outbursts of fire. It's not a real fire that's just raging. They just have underlying deficiency with outbursts of fire. We call that kidney and liver yin deficiency with yang excess creating wind. They look very similar to liver wind. They're both liver wind. One's from true fire, one's from false fire. The true fire, they're going to be red and swollen and bounding, pulsing red eyes and loud voice. And the yin deficient case, they're going to be a little more listless and pale. This is the one that's got the tinnitus and the ear ringing high pitch, worse at night, worse when it's quiet. Low back pain, thin tongue, little quivering. The liver fire is going to be a bright red tongue, going, So those are both liver wind caused vertigo. One is true fire excess causing wind, and one is kidney liver yin deficiency, leading to floating yang, producing liver wind. There's some other internal cases, once again, spleen and stomach deficiency with damp. I've offered that on several previous podcasts. Digestive weakness with retention of phlegm in the body can create phlegm in the apparatus and goo up the system, so that it's not, the person gets dizzy and vertigo. They get lack of hearing. They'll be heavy. They'll be listless. They'll have copious phlegm, leukorrhea, undigested food in the stool, fibromyalgia, bloated tongue with teeth marks in the tongue. That's a spleen and stomach qi deficiency leading to retention of damp, causing an obstruction in the ears, leading to vertigo. Now, those are excess. Those are all pretty much excess cases, minus the kidney, liver, yin leading to a false excess. It's still an excess, just a false excess. There are true deficiencies that cause vertigo and dizziness, the first of which is qi and blood. There's not enough blood, there's too low blood pressure, or if the blood starts getting clots, person will get dizzy. Strokes, people have dizziness quite often. That's the qi and blood deficiency leading to blood stagnation. And then the last one is going to be kidney jing deficiency, just deflation of the person's marrow and bones and kidneys. This is an old person, listless, pale, dizzy, back pain, thready pulse, thin tongue, pale lips. The qi and blood stagnation, they're going to have a purple tongue, purple peticulae tongue with bumps all over, with a choppy pulse. The kidney jing deficient, thin, thready pulse. These are all different causes of dizziness. So once again, in summary, the external causes is an initial invasion of wind cold. The next one is an intermediate invasion of wind cold. We call Xiaoyang. That's the one with the alternating fevers and chills. It can be external, blocking the muscles, creating tightness. It could be external blunt trauma. It could be internal liver fire, creating wind. It could be internal liver yin and kidney yin deficiency, causing floating yang to win. It could be spleen and qi deficiency with retention of damp. It could be qi and blood deficiency with blood stagnation, and it can be kidney yin deficiency. That's what we got in differential diagnosis and associated sign and symptoms for dizziness from Chinese medicine.
That's awesome. One of it's the, was it the qi and blood deficiency with, that sounds extremely like what I would call hypotension. So as they stand up, there's not enough blood flow to the brain. They get dizzy and then they might fall.
Gosh, and what's the name of that test?
There's
orthostatic hypotension.
Orthostatic hypotension.
Go back to the emergency days. Orthostatic hypotension, yeah.
I don't see it that much. I'm like, I test it, I'm like, what's your blood pressure sitting? What's your blood pressure standing? I don't see it that much, but occasionally.
Which ones do you see the most of?
I see the most of, I have seen patients with the liver fire dizziness, and I've seen the liver fire with the kidney deficiency. Very difficult to treat
Not our side. From our side, those ones are the easier.
Really?
And then the external wind cold obstructing the channels, creating the muscle tension in the shoulder. That one, I see mostly the liver fire cases, and then the liver fire with kidney yin deficiency, and then the tightness of the muscles obstructing the flow of energy to the ear. This tight, rigid shoulder, neck.
Yeah. But holding phones like this probably isn't. Hopefully.
All right, so now can I talk about this case? It's a beautiful one. In America, we had a political change recently with our president. Half the country or more really supports it, and then there's another half that doesn't. So there's a lot of people on both sides. One of my clients really wasn't happy about it, but she's a nice lady. She's built her whole life on a nice persona, but she's pissed. And she's got this liver fire, but she's afraid if she lets it out, she won't be accepted. So the small intestine meridian, the meridian of acceptance, that what we're going to let in and that which we won't. There's that liver fire came up, that small intestine just said, no, I'm not going to beat that, because she's a nice person. So her inside is that. But her outside persona is just this really sweet and nice person. And she's got this inner battle debate leading to liver fire going up to small intestine blockage of the meridian, creating terrible dizziness and also lack of hearing in that one ear.
Wow, that is so cool.
Isn't that great?
So cool. And just quick, the small intestine meridian in that area is what's the actual levator
scapula, which goes right behind the mastoid and attaches to the back of the vestibular apparatus, and then it goes through supraspinatus, infraspinatus, teres, triceps, flexor ulnaris, and then abductor digiti quinti.
Nice.
So it goes down to the pinky.
Down to the pinky, but it's right there. That's amazing. pulling on the apparatus. That's so
Yeah,
cool.
the emotional response to the external environment was so strong that it created liver tightness through anger frustration that led to fire that came up that she wouldn't release. Her small intestine wouldn't allow her. So the small intestine locked up to hold the liver fire down, and that's what created the dizziness, overdose, and deafness.
What a cool case, man. That is epic. That's so cool.
Great, isn't it? Yeah, there's a bunch, man. There's a bunch. She was a true excess. I've seen several true excess. The nice thing about excesses is they clear easy. They're easier to treat. Deficiencies take longer to nerve. And if they've got an excess and a deficient, we got to clear the excess and then nourish the deficiency. It's a long time, particularly if they're still engaging in the same diet, thought, behavior patterns that gave rise to the symptoms in the first place.
Well, that's an interesting little transition across. Why don't we jump into to management? Super interesting. Look, the benign paroxysmal positional vertigo. The treatment for that is in general practice textbook. It actually suggests that they might benefit from cervical traction and manipulation. So actually working on the neck and releasing it, which I thought was really cool. So that was certainly within that, and I would, as a GP, refer out for chiro osteopaths to work on that. The other option for treatment for this is the Epley maneuver or the Semont exercise. And basically the idea of this is these excess crystals, or to try and get them out of the semicircular canals and drop them into the lower part of where those semicircular canals arise from, take them out of there so they no longer trigger. So they're interesting maneuvers that involve sort of going to 45 degrees, going all the way over to one side and then all the way back quickly, there's a great YouTube on this. It's just like, I hope the elderly are not trying to do that one. But
yeah, what about those with vertigo?
It will. Yeah, you love this treatment. It will trigger your symptoms, and I think the idea is like to just try and neurally reprogram that. Eventually, the body learns that this isn't the right thing. But man, it sounds like a lot of work to me. Like to be triggered all the time. But nonetheless, they are the treatments. Having said that, the other advice, fascinatingly, is avoid triggering events. So I don't know what we're meant to do with the treatment itself triggers it, but anyway. Usually spontaneously recovered, but recurrence are common. So that's an interesting one. Might resolve. I wonder, even with the treatment, whether possibly chopping off the top of the iceberg and then it shows up in some other area. I don't know, where that would go. But look, the viral neuronitis labyrinthitis, also wonderful. Rest in bed and lie very still, which is a tough one. That really doesn't sound like much fun either. And gaze in a direction that minimizes the symptoms. So perhaps some kind of a mismatch between the eyes and the ears, something like a seasickness phenomenon. And if I just look in that direction and lie very still, it might pass. Interesting from a medication point of view, Stemetil or prochlorperazine, you can take that. That is an anti-nausea drug, or diazepam, 5 milligrams 3 times a day. Now, Valium, commonly known as Valium, interestingly, its other uses are in terms of, it can be used for anger management and anxiety management. So I'm figuring from a Chinese perspective, Valium somehow affects the... And pain. It works pretty good.
Using it as pain nowadays.
Yeah. A lot of pain patients seem to end up on the OxyContin Valium combo for pain relief. So anyway, so that's I can use steroids if it's very severe. Can be severe enough to require hospitalization. I mean, that's bad. That's a bad case, and ending up in hospitalization. Meniere's. Also, for acute attacks, they suggest possibly using a suppository of Stemetil, so to prevent the nausea and vomiting that might come if they vomit up the drugs. That doesn't sound like much fun. And fascinatingly, I found this one, the possible treatment, 30 grams of urea crystals in orange juice. 30 grams of urea crystals. I'm like, wow, what are they? And I told one of my patients and one of the other doctors, they're like, are they using urine therapy? How did they learn this? Anyway, so I'm wondering whether that's like nourishing the kidneys or something like that. It's an odd one, but I've never used it. But yeah. Anyway, the interesting thing with many is avoiding excess salts, avoiding coffee. Diuretics might be worth trying. Improve stress management, and if it's intractable, surgery. But that would be very much a last case scenario.
What surgery?
I think they just cut out the semicircular canal.
You see what I'm saying? Wait. It might be very valuable, and I'm very glad it's been developed. It might be a very useful procedure, but I might suggest trying alternative therapies before that.
I don't know. It might not work that well. Neuromas.
I don't know.
It might.
It seems pretty extreme. I like having a vestibular apparatus. It helps me navigate through the world.
Yes,
Yeah.
Absolutely. Yeah. Actually, there's one more thing that has craniosacral therapy within Mullumbimby. There has been a few people, and the theory being that somehow the bony encasement of the labyrinth is slightly tweaked. And so if the craniosacral can resolve that, then the signals match again, instead of like having this permanent mismatch. And so
in an esoteric sense, that's interesting. In a very simple sense, just holding the back of the neck there for 15 or 20 minutes, regardless of body brainwave disharmony, just holding there with the human touch and the warmth and the increased circulation, the releasing of muscles and the decompressing of the spaces in the bones, and listening and facilitating the movement of the skull bones and creating breath movement through the skull plates, all of that would help tremendously physically. Even I do believe in craniosacral that there is a deeper body harmonic and wave in a more esoteric sense, but just in a gross physical sense. Just one of the 5 therapeutic branches is physical manipulation.
Absolutely. My community is pretty open to it. I'm like, well before surgery, let's go try craniosacral.
Yeah, for sure.
Good results, So, all right, what do you got? I'm hoping you got some good stuff on this topic because, what do you got?
So, once again, within Chinese diagnosis, we use the system of 8 principles. Is it from the outside coming in? Is it the inside coming out? Is it the nature of heat, or is it by the nature of cold? Is it a deficient condition? Is in the next section associated with that's how we diagnose and differentiate. When it comes to therapeutics, we've got 5 limbs in therapeutics: diet therapy, herbal therapy, physical manipulation, acupuncture, and then movement therapy in the sense of Qi Gong Tai Chi. Did I get all of them? Herb, diet, acupuncture, Qi Gong Tai Chi.
And physical manipulation.
Massage therapy, physical manipulation. Thank you. So as you've seen in the past, based on the different therapeutic options have greater or less efficacy. In the external cases of wind cold and wind damp and wind heat, just doing simple stuff like avoiding the wind, avoiding the triggers, as you said, covering up the neck. If the ear feels cold, warm it up. If the ear feels hot, cool it down. If it feels wet, dry it out. We actually use a wind, like a hair dryer at times, as long as they don't have too much wind. If it's to the Shaoyang level where it's intermittent, nausea, vomiting, alternating fever, chills, herbalism, Chai Hu Shugan Wan and Wen Dong Dong. There's these 2 formulas, Chai Hu Shugan Wan in particular. Chai Hu is the main herb that guides. We have a principle in herbalism called guiding herbs. And if you happen to have symptoms here, use a guiding herb there. If you have symptoms here, use a guiding herb here. And the guiding herb is Chai Hu. So Chai Hu Shugan Wan is the formula for the intermittent external endogenous factors. For the cases of external with muscle rigidity and tightness, just like you guys said, massage therapy. Although you said you would refer to chiropractor or osteopathy, we could also use acupuncture, Chinese medicine, and massage therapists. Any one of the physical body workers works really well. with the physical tension leading up to vertigo. Now, if you can get an emotional body therapist who will not only release the physical, but at the same time create an opportunity for the emotional release, if the person needs to scream, yell, cry, whatever it is that they're holding back, if they can release that, that's where I find the results to be extremely fast, like within hours to days, and it's gone for a while, as long as they don't get re-triggered. In the case of the external blow trauma with blood stagnation, heat, this one you'll know it's worse with pressure. Worse when you touch it. There'll be bruising, could be bruising, tongue will be purple. Then there's a history of a blunt traumatic episode. With those, herbalism, once again, I mean, we got herbs that can dissolve bloods. For instance, leeches. So we use dry leeches as a powder, boil it as a tea. And the enzymes that the leeches have to dissolve blood clots then goes into a tea, gets strength, and dissolves the blood stagnation. Don't do that particular one because there's a better formulas. Shui Fu Ju Tong. And then in my research, I found one that was just awesome. Tong Xiao Ho Shui Tong. Open and unblock the orifices and invigorate the blood decoction. It's specific for dizziness, vertigo, with blood stagnation through trauma in the ear. By the way, blood stagnation from trauma can also be machine gun fire or large, big motor use. Anything with the heavy metal, ting, 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 ting. I've had veterans that I've treated with dizziness from blood stagnation from machine gun fire.
Wow. And heavy machinery as well.
Yeah, that's a trauma. Sound waves are a trauma to the ear.
Yeah, wow.
And therefore the vestibule, isn't it? So that can be a differential diagnosis in this case. For the internal cases, the liver fire one, diet lifestyle, no whiskey, no coffee, stop getting pissed off, no chili powder, no chili sauce, no chili, no ginger, no turmeric. I live in a community where they think one thing treats everything, and it kind of, but not always. So if there's heat, don't heat it up. So they got liver fire, don't poke the bear, don't piss them off. Get them to some Gestalt therapy to beat up some pillows and scream. Release the fire. Acupuncture works well for that. Self-massage can work well for that. The liver fire one's the easiest one to treat, honestly. And then there's herbal formulas that work really well for that. Longdan Shagon Tong, in particular, Mudon Pia single herb. One time I gave a guy with this just Mudon Pia single herb. He did it for 2 weeks. It pulls the liver fire out through the urine, and he just had screaming hot pee for a couple days. He thought he had a UTI. There wasn't a UTI. He asked me if I'm like, yeah, that's what I pulled his liver fire out through his pee. Longdan Shagon Tong. That's the formula that does that.
That's cool.
Now, the other liver fire case, with the kidney yin deficiency, this is somebody who's also pissed off, that's working a lot, that's really fired up, that's really in charge and on charge, but they're tired and they're weak. They've been doing it for too long. So they still got the liver fire, but they got the kidney yin deficiency. It's like I got a bartender that works all the time, works nights, works off hours, finishes with cocktails. He's really stressed. He just had a second child. He's buying a house. He's got this whole it's just all liver gallbladder with some extra little fire on top of kidney deficiency. So for that one, Tianma Gotang Yin, there's a formula. Besides the formula of just get some rest and chill out. And no spicy chicken wings. Have some cucumber salad. Some seaweed and mint tea.
Mint tea.
Mint tea. Yeah, I mean, for the liver gallbladder fire, foods that are good: celery juice, Chinese cabbage steamed, watermelon peel, pears, mung bean paste, green tea lightly steeped, mint tea. All these things cool off the liver. So diet lifestyle really for the liver fire case. And even with the liver kidney yin deficiency, liver fire, that's also lifestyle. But the Tianma Gotang Yin, it works really well as a formula. The Longdan Shagon Tong, now that one, because it pulls liver fire out from urine, it can't be used for very long because it'll dry out the liver and the kidney. Because it pulls the fire through the liver, the kidney, through the urine. So it's also heats the liver or the kidney as it drains, and it dehydrates the body because it's a diuretic. So it can't be used for a long period. Tianma Gotang Yin can be. The other cases of the blood stagnation I talked about, as far as the internal cause, and then the kidney Jing deficiency. That one's tough. I mean, if a person's really gotten to the point that their kidney Jing is deficient, the Jing in Chinese medicine is what we say is our prenatal essence. It's the energy that comes into us through our umbilical cord, gets stored in our kidneys, and it's the vital life force energy of the body. Some people get a lot, some people get a little. It's just what we get. Some people are stronger than others. The ones that are already born weak, or the ones that are strong and then they get weak because they never rest or they don't nourish themselves, these cases are very hard to congenitally tonify. I mean, there's Qi Gong, there's Tai Chi, there's Taoist alchemy, all these internal methods to strengthen the body. There's dietary methods, black bone chicken soup, marrow stock, oxtail soup, these deep kidney pie, just these deep, heavy foods. And then there's herbal formulas once again to do. There's the Urgent Wan, 2 miracle pill, the ultimate substance decoction. 2 herbs that are designed, Nu Jensa and Han Lian Sao. They're supposed to be harvested at the peak of the new moon and the peak of the spring, which we're having right now. We just had our equinox. So right now, full moon equinox is when they're supposed to be harvested, or at the solstice. So high energy food, these 2 herbs. But I mean, once again, if a person's still just burning it at both ends and running on coffee without food, there's no ATP in coffee, eh?
There's no ATP in coffee.
There's no ATP in coffee. It's a catecholamine. It's a sympathomimetic. It draws the energy out of the kidneys. So those are our differential diagnosis and the associated treatments. Yeah,
that's epic.
And a couple of case examples.
Yeah, perfect. All right. Let's maybe open it up a little bit. Well, where are we? East meets West. What a cool topic.
There's one thing I wanted to share with you on the overview. You may have noticed now we've done 3 different syndromes, and there's similar etiologies under each. For example, liver fire can create asthma, ulcerative colitis, and vertigo.
Yes.
Interesting. Yes. Spleen Qi deficiency with retention of damp can also create asthma, ulcerative colitis, and vertigo. Is this interesting? What I wanted to bring up is how come one person with one pathological influence will have one symptom picture and another with the same will end up with a different symptom picture. If one person has liver fire, one person might end up with asthma, one might end up with ulcerative colitis, and one might end up with vertigo. Okay. Why?
That was my question, because I'm like, what is it? It's all the same. It's looking like the same stuff. What the heck?
That's why. So it's not. We happen to pick similar syndromes. This is the beauty of Chinese medicine and not the weakness. If one person is congenitally weak in their large intestine, or if they've had a whole bunch of grief that they're stomaching and they're pushing down that they're not breathing into, when they have liver fire, because that's where there's a weakness or accumulation, that's where it's going to affect. If another person already has lack of self-worth or has been exposed to a whole bunch of smoke or environmental toxins and their lungs are the weak organ, when they have liver heat, it's going to scorch there. That's where the pipes constrict and they're going to get asthma. Other people, if the lungs are open and they can just shout it out, and they're used to bringing that up, they're the ones that are going to end up with vertigo. Other people will sex liver fire out and they'll end up with all sorts of GI and endocrinological problems, or even to the point of hiatal hernias, if they've got a bunch of swelling heat going down. So it's interesting, the same pathological influence, for instance, in this case, liver fire would express differently on different people, being the same root etiology under asthma, ulcerative colitis, any one of a given symptoms.
That's super cool. So where's the weakness, and as that syndrome expresses into the weakness,
or accumulation.
Or accumulation as well.
Yeah, if somebody's been smoking a whole bunch and the lungs are just full of phlegm, hot, damp, when that energy comes through, that's where it's going to express itself symptomatically. The person will think the symptom's there, but it's this whole other energy flow coming through the body, and that's where the pipe is either blown or too tight. It's either too weak or it's too full. Isn't that cool? So some people with spleen Qi deficiency are going to end up with fluid backing up into their lungs. Some people with spleen Qi deficiency are going to have the dampness going down, accumulating in their colon, creating ulcerative colitis. Other ones, they've got this liver spleen disharmony, or they're, and I'm not getting what I want, and I'm not getting nourished, and I'm not getting what I want, I'm not getting nourished. They got that liver gallbladder with the spleen deficiency, then the dampness of the spleen and that heat in the gallbladder will raise the spleen damp up into the ear, creating the vertigo.
Super cool. Super cool.
Isn't
It's
that
amazing.
Yeah.
And so to just treat the symptomatically, I mean, it sounds like it can be done, but if they've got the underlying deficiency
Coming back.
or the underlying pathology,
It's coming back.
it's coming
How
back.
do you treat it symptomatically? You cut out the vestibular apparatus, or you bathe it in steroids, or you numb the signal with GABA agonists?
Yeah.
I mean, okay, yeah, it works. It works. And symptomatic relief is pretty darn important, especially when somebody's too dizzy to walk down the hall or they can't get up. Symptomatic relief is paramount. Western medicine is darn fine at it. But in the intermittent phases, using Chinese differentiation and differential diagnosis, with treating the root of the disease under the stem or the branch, can create long-term changes where it doesn't come back, therefore solving a lot of added costs in healthcare.
Which is coming down the pipe for us. I mean, the baby boomers are coming into their elderly years. There's a lot of expense that could be saved. This is really cool.
Treat them once with Western medicine, get the symptoms resolved, send them to Chinese or an alternative practitioner, do differential diagnosis when appropriate, which you now know which ones we can do and which ones we can't, and then have us treat the root so that they don't need to keep coming back into your office.
It's great.
And then that relieves a burden for the whole system. And the client themselves, not even system level, but just individual, they get relieved of symptoms.
They get a happy life.
This is what we want, right? Good health.
Good health. It's frustrating. The chronic health. It's frustrating for me not to be able to help them. It's like, okay, and it's frustrating for them. It's really hard for them. So this is great. This is really
the acupuncture works really well too, just needling around the whole area, and people can do the massage, but that's only in certain cases of excess and stagnation. If it's deficiency or hollowness, it's hard to you have to treat it from the inside, diet, lifestyle, or.
It's cool. Super cool. I love it. All right. Yeah, I was just super interested and to go through this topic, and let's wrap this one up. If you join us again, if you've got comments, then add those below wherever this video is up. If you're listening to us on the podcast, share it. Hope you enjoyed it. TJ, thank you so much for joining in this, and look forward to seeing you on the next one.
All right on, Tom. Thank you for your time and for the concept of Eats Meets West, good friends and good health. Aloha. Till next time.
Till next time. Aloha.